family-friendly, a global vision, and a holistic approach to thinking and living. Unlike any other media source on the planet, welcome to Hope Channel.
Diseases and disabilities, just like calamities and natural disorders, are actually no respecter of persons. Whether you are young or old, educated or not, rich or poor, sometime in our lifetime, we do get sick. Sometimes getting sick even becomes a trending. Dynamic Living, the Total You, would like to invite you, dear viewers, in the next 60 minutes as we feature our partners in health, the PhilHealth, as they take care of the Filipinos. I am very much honored tonight as I am joined here by our team of experts from the PhilHealth. I'd like to start off introducing Marlon Arabaca. He is the head, Local Health Insurance Corporation. Good evening, Marlon.
Yes, good evening, Doc, and it's good to be back. And we are very happy that you invited us in order for us to share the latest updates coming from our office.
Yes, because I remember inviting you here years back, no? Medyo matagal na yon.
Yes,
So
yes.
marami ng bago, so to speak. And of course, joining us also is the Chair, Public Affairs of PhilHealth, Region 10, Attorney Aiza Monting.
Yes.
Good evening, Attorney.
Good evening, Doc. Good evening also to all our televiewers. We are happy to be here. In behalf of Dato Masiding Alonto, our Regional Vice President, we are glad you invited us to join you and inform the public more about PhilHealth and its new benefits.
Yes. And of course, hindi kompleto ang ating pag-uusap kung wala naman yung sa accreditation. Kasi paano naman how assured are we na yung ating mga healthcare providers talaga namang able and capable of giving us the best quality service there is, no? So I'd like to welcome to the show a very good friend, Dr. Jonathan Ortigoza. Good evening,
Doc. It's my first time to be here, so thank you very much for the invitation. I hope that I can contribute some valuable information to our viewers today.
Okay, hindi lang yan first at last, no? So marami pang
Hopefully.
susunod niyan, ha? So I assure you, you will be getting more invitations from us.
Thank you very much. It's an honor.
Yeah, so, you know, PhilHealth has been in place for quite some time, no? So, can you briefly tell us, any way sa inyo, kung sino sa inyong gusto sumagot nito, how long has you been in existence?
The PhilHealth, the law creating PhilHealth was signed in 1995. So PhilHealth has been in existence for 19 years. But the regional office here in Cagayan de Oro opened its doors to the public in 1999.
Medyo mas nahuli ng konti kaysa doon sa ating national natin.
Yes.
Would you say na in terms of growth, would you say exponential ang growth ng PhilHealth in terms of number 1 sa membership, number 2 doon tungkol sa mga healthcare providers na involved, and number 3 in terms of benefits?
Yes, very much, Doc, no? Because at first, PhilHealth only catered mostly to the employed sector. And then there made a difference after years of being in operation. Nadagdag na yung mga OFW. And of course, there is a dramatic increase of our sponsored program. We just started before, say, 10 years, 15 years back with a very, very small enrollees under the sponsored program. When I say the sponsored program, this is mostly under the local government units. And now, it is more than a million. No? And we are glad that the trending is this way. And we are also glad that at the start of 2012, national government started to enroll also poor families in PhilHealth. And this, again, paved the way in increasing the enrollment of PhilHealth. And when we increase our enrollment, it goes without saying that we also increase our collections, because the more members that we have, the more collections that we have. But on the other hand, also, we are also increasing in our benefit payments, again, because of the increase in membership.
Pag sinabi mo na exponential ang growth mo, including sa benefits, including sa collections and everything, would you say na, di ba kasi ibang mga bansa, if you look at it like in the States or maybe in London or Britain, sila, European countries, they also have their own healthcare insurance groups, no? And the government also is taking care of them. Would you say na tayo, we patterned it after them? Or tayo talaga, naiiba ang Pinoy, may sarili talaga siyang ginawa para lang that will fit into the needs of our people?
As far as I know, Doc, no, we patterned it from Germany, because Germany has this what we call universal coverage. Everybody is enrolled there. Even if you cannot afford, the government will try to sponsor you, to enroll you to their own social health insurance. And that is why we are looking after Germany, so that even in the payment, like what we have, the so-called capitation fund before, and now we call it a per family payment rate. This is again patterned with the social health insurance of Germany. In fact, every year we are sending employees of PhilHealth, no, to study for 1 year in Germany, to look into the nitty-gritty in their implementation of their social health insurance program, so that we can also apply it here.
Pag sinabi mo na universal health program, does it mean na you have a targeted time frame wherein you would say na 100% lahat tayo meron tayong coverage? Kasi sa ngayon yata hindi pa, di ba?
Yes.
Attorney, would you say how many percent po kaya tayo ngayon na enrolled? Like for example, Region 10, let's just look at Region 10. Kasi mas maliit siya na area, mas madali siyang anuhin eh.
In Region 10, we already declared universal health coverage. Now, in PhilHealth definition, universal health care or universal coverage would mean 85% of the Filipinos are enrolled.
So malaki yun, mataas yun.
Enrolled to PhilHealth.
If you go back to 1995 when sinabi mo na ang formal sector lang, would you say na there's a 200 or 300% increase in the number of enrollees?
I think based on estimates, 600% increase, no? Because that years back, it's really very, very small. It's really very small, and there was a bulk of enrollment coming from the sponsored program and also coming from the OWP sector. And Doctora, this is the only government agency wherein we enroll all walks of life.
Yeah, nakita ko nga eh. Para bang pwede ang mayaman, pwede ang mahirap, pwede yung walang trabaho, pwede yung may trabaho, di ba?
Yes, like,
so,
regardless of age also.
Walang ano yun, di ba? Parang walang categorization na, heto, bawal siya maging member. Wala kayong binawal dun, di ba? But later on, as we continue on discussing, we'll have to inform our viewers also para malaman din nila na them being as members, meron din naman silang obligations, di ba? Kasi it goes both ways. Now, let's go naman to Dr. Jonathan, who is involved in the accreditation.
Yes.
Hearing sila Marlon and attorney, knowing na exponential ang growth ng ating membership, would you say na kayo din sa level ninyo in terms of healthcare providers naman, kasi members yung kanila eh. So it goes both ways then. So yung inyo naman in terms of yung healthcare providers, would you say also na may exponential growth din kayo in terms of involvement?
Yes, Dr. As in the definition of PhilHealth, healthcare providers can mean the institutions and the professionals. So for the institutions, we call it as HCI or healthcare institutions. So this will comprise the hospitals, also the PCV1 providers or the new term check-up providers, the maternity care providers, the TB dots, also the animal bite treatment centers, and also the malaria centers.
What about yung mga clinics, like yung mga freestanding clinics? Ako si Doktora, gusto kong magtayo ng sariling clinic ko dyan sa Cogon Market. Andun yung aking mga kaibigan dyan, no? Hello po sa inyo lahat na nanonood dyan sa Cogon Market, no? Aking mga suki dyan sa isda. So, at gulay. So, aking point there, kung kunyari, nagtayo nga ako ng clinic dun sa Cogon, can I be a partner for PhilHealth?
So you mean, Dr. Astikwan, you're putting up a private clinic?
Yes, just a clinic na para lang ma-cater to yung mga pasyente doon.
As of the moment, Doc, is our PCB1 or the check-up services is for the government, rural health units or district health offices. But regarding for the rollout to the private physicians, we hopefully by next year, we plan to roll it out to the private physicians, but also bounded by rules and regulations of the corporation.
Of course, kailangan
yes,
meron eh.
yes.
Kasi mamaya maabusuhan naman yan. Inaiiba ang Pinoy eh. Palaging merong lusot yan. Yes, Marlon.
Yes, going back to creating a clinic, I think the clinic itself cannot be accredited or cannot be permitted by PhilHealth to operate as one because as Doc John Naxa said, only public rural health units are allowed. But you as a physician,
Can
as
be
a
an
professional,
accredited.
yes, can be accredited, and then you practice your profession in any accredited hospital, then of course, the patient can use the PhilHealth
So
benefit.
would you say, John, na hetong mga doctors, the specialists, would you say, there is also a rising number of specialists who would like to join hands with you also in the taking care of our members?
Since I joined the corporation last 2007, I can say that basing on the statistics from the healthcare institutions, it has risen in number. From the hospitals and also for the ambulatory surgical clinic, we have 2 in Cagayan de Oro City, and also for our freestanding dialysis clinic, it has been rising in number. Also, our accredited RHUs are also rising in number, and also our healthcare professionals. From the time I entered PhilHealth in 2007, every year, it has increased in number.
So madami-dami na talaga.
I'm very happy that our healthcare providers and also the professionals are very open to participate in the National Health Insurance Program.
Oo, kamahalaga yun. Kasi kasama yun sa ating serbisyo publiko, di ba, attorney? So, heto bang, dati kasi meron tayong tinatawag na fee for service. Eh, ngayon yata, you are more of an all-case rate. Ano ba ito at anong pagkakaiba nila?
When we speak of all case rate or ACR in short, it's not a benefit, but it's a payment mechanism for reimbursing and paying claims to our healthcare providers. Before ACR, we have the fee for service. We compute the reimbursement per service, per room, per professional fee, per cotton used, or per...
So, para bang kailangan bilangin lahat ng ginamit sa pasyente, ganun ba yun? At lahat ng bisita ng doktor, kailangan bilangin mo. Kung 4 na beses si doktora nag-aano doon, na bumisita, so ganun ba yun? Eh, yung ngayon, yung ginawa ninyo sa ACR, hindi na ganun.
Hindi na ganon. In ACR, we have this list of covered illnesses and surgical cases with its corresponding case rate. So the rates are fixed. It includes the room and board, the professional fee, and all other facility charges. Example, for dengue 1, the case rate is 10,000. So if the hospital bills you 9,000, so you go home without paying anything. But if the hospital bills you 12,000 pesos, then you go home paying them 2,000. So 10,000 will be paid by the
member?
by the PhilHealth. By PhilHealth.
By PhilHealth.
With ACR, we shifted from fee for service to ACR to because we want to be more transparent to our members. Before ACR, a member wouldn't know how much he or she will be paying until the day nga ma-discharge na siya. So now, beforehand, you already know kung pila imong bayaran. So for this list, they can always check our website at www.philhealth.gov.ph. We have those.
Pero heto naman, attorney Marlon at saka John, pag sinabi ninyo na ginawa ninyo to, I'm very sure it underwent extensive studies with consultations, no, with the partners. Kasi syempre, when you say na you came up with a listing of the illnesses na heto yung kanilang equivalence nito, medyo naman na mas maganda ito because it becomes universal talaga. Kasi minsan ang nangyayari kunyari dengue, titira siya doon ng 15 days, tapos aabot na yung bill niya ng kung magkano. Kawawa naman yung member, pero kawawa din naman yung healthcare provider, yung institution, di ba? O yung professionals involved.
Yes, there was indeed a consultation. We consulted the hospital associations, both the private and because as we understand, there are 2 hospital associations, public and the private one. So silang dalawa, kinonsult natin, no? And the specialty societies. And even to the extent that we are always keeping the minutes of those meetings so that pag merong magtatanong ng mga professionals or merong hospital
Papapakita.
administrator, papakita natin what transpired into that meeting so that we can justify especially the amount of benefits that we are giving.
So aside from dito sa ACR ninyo, meron kayong tinatawag na catastrophic illnesses. Ano naman ito?
Okay, catastrophic illnesses mostly will fall under our Z benefit. No? In layman's term, these are cases na yung malapit ng, for the Catholics, malapit na makita si San Pedro, kumbaga.
Okay. So ito yung mga kumbaga terminal illnesses.
Yes, yes.
Pero hindi naman lahat po pwede dito, di ba? So
Yes.
briefly, ano-ano ang pwede para sa mga viewers natin na, for example, they're viewing in their homes and then may mga may kapitbahay sila or kamag-anak na may ganitong sakit. So they might say na, ito pala, pwede pala ito i-avail.
As what Marlon has said regarding sa catastrophic illnesses, so it is now under the type Z. If you can remember our fee for service, it has been classified into case category A, B, C, and D. So A, the most simple cases, simple. Then D
Ibig
is
sabihin
the-
ng simple, kunyari, influenza virus,
Yes,
o simple yun. Urti, upper respiratory tract
yes,
infection.
Then D is the most more serious illnesses. So as what Marlon has said is type Z parang malapit nang makita si San Pedro. But if you can look at our alphabet, di ba? Z is the last letter.
Last
So
letter.
it,
So it's
is,
the last
it
bit.
means that somehow it is the most serious of all the serious illnesses.
Yes.
As of the moment, when we roll out the type Z benefits, first four cases covered are the acute lymphoblastic leukemia, the breast cancer, prostate cancer, and also the kidney transplant.
So apat yan. So
Yes,
balikan natin
the
para for first four,
Initially.
para
Initially.
initially para alam ng mga viewers natin. So acute lymphoblastic leukemia. Bakit acute lymphoblastic? Hindi yung myelogenous at saka CML.
Actually, that is there are a lot of questions regarding that one. But as what Marlon has said, before we roll out our programs, it has undergone various consultative meetings.
So yun lang ang pinili ng ating mga hematology friends.
But we would like to make it clear that it does not mean that it will not be covered by PhilHealth.
Okay.
It will still be paid by PhilHealth, but not under the Type Z benefit.
Pag sinabi mo palang type Z benefit, ano palang meron doon na bakit kailangan heto siya, pwede siya dito? I mean, is it a full coverage? In other words, no holds barred. In other words, lahat ng gamit niya mula sa diagnosis, papunta sa operation, papunta sa chemotherapy niya, covered nito?
As what, during our forums, it has been stated that the cases classified under Type Z, it is more that they have a more chance of survival. So, compared to other diseases, these serious illnesses have more chance of recovery, such as if it has been discovered and treated earlier. That is why in Type Z, it is more like a Pacquiaoan system. It should be under a specific contracted hospital. In our
So pag sinabi mong specific contracted hospital, hindi lahat ng hospitals
Yes,
po
Doc.
pwede silang pumunta
Yes,
doon.
Yes.
So ibig sabihin, ako na pasyente ako, kunyari nandito ako sa hospital na to, and then gusto kong mag-avail nito na Z package, hindi ako pwede kung hindi siya approved sa inyong
Yes.
listing ninyo.
Yes.
So meron kayong listing talaga.
Yes, as of the moment, in
Dito sa Region 10.
it is the contracted hospital is the Northern Mindanao Medical Center.
So lahat ba government institutions in the entire Philippines o meron din kayong private partners?
As of the moment, we rolled it out to the government hospitals because as what our private hospitals have said, basing on the amount, they stated that somehow kulang daw ang bayad sa PhilHealth for the private hospital. So that is why, for the moment, we just roll it out in the government accredited hospitals. But hopefully, we are really hoping that it
It will open the way also for our private health institutions to join us in
Yes,
this part.
bec-
Pero bago lang to, di ba?
Since around late 2012, the initial rollout, then later on, we have additional packages for the Z benefits, such as the coronary artery bypass graft, for surgical treatment of tetralogy of Fallot, also treatment for the surgical treatment for the VSD or ventricular septal
So these are
defect.
actually congenital heart
Yes,
diseases.
congenital. And also for the cervical cancers, there are two types. Cervical cancer low-dose radiation therapy worth 120,000, and for the high-dose therapy of cervical cancer, 175,000.
So under ito dito sa Z package na
Yes.
walang babayaran yung member.
Yes, so that is why for the moment, for the contracted government hospital, if the patient is sponsored member, no copay, so no balance billing. But we are contracting also the government hospitals
Can,
that
can, can anybody, can any PhilHealth member avail of this? Or is there also a requirement bago sila pwedeng pumasok sa ganito?
there are criterias that they should meet before they will be enrolled to the Type Z benefit package. So we have the term as ZBITS, the Benefit Information Tracking System. So not all patients with diagnosed cases can avail of the Type Z. They should undergo screening. The hospitals should have a screening committee. Then they will inform the PhilHealth. They will submit a authorization form. So if we will approve the authorization form, meaning to say they are enrolled in the Type Z benefit package. So as of the moment, the no copay is only under the sponsored members. We are negotiating with the contracted hospital that for other form of membership, hopefully they will only have a fixed
Pag
copay.
sinabi na, sige, ano yun natin, isa-isahin natin. Kasi parang heavy, nosebleed ako eh. So, ganito yun. So, hinga ang malalim. Okay, pag sinabi mong Zay benefit siya, na pwedeng mag-avail, any member can avail provided sponsored siya ng government.
Actually,
It's a sponsored member. Is that it?
Actually, all.
All. So
Yes,
whether
I would
galing
like to
siya
make
sa
it clear.
yeah,
Yes,
whether
all.
galing siya sa formal sector, whether
Yes.
sa indigent siya, OFW siya,
Yes,
o kaya naman sponsored siya ng LGU or ng DOH kasi ang DOH namigay eh, 'di ba, ng mga ano nila, mga cards ng PhilHealth. So kahit sino sa kanila pwedeng sumali
Yes,
nito.
oo.
Kaso lang ang kailangan nila ay pumunta sila doon sa yung ospital na naaprubahan ninyo.
Yes,
And for
contracted.
Region 10, dear viewers, it's only in Northern Mindanao Medical Center. So pagdating ninyo doon, kailangan kayong ma-screen muna.
Yes.
Pag na-screen kayo at pumasa kayo doon sa screening, kumbaga, saka pa kayo ngayon pwede mag-avail kasi ifo-forward nila yan sa inyo, sa PhilHealth, for approval. And if PhilHealth says, okay, pwede na, babalik na yun ngayon doon sa kanila, pwede na sila to avail of
Yes.
this benefit.
I
Yes.
would like to add, for NMMC, not all of the Z benefits are
Available also.
available. Only the first four mentioned by Dr. Artigosa.
So wala pa yung mga congenital heart diseases.
Wala pa. They're
O,
still
nandun
working
pa lang,
on it.
Nandun pa lang kayo sa leukemia, which is acute
Yes.
lymphoblastic. And
Breast
then nandun
cancer.
sa breast cancer. Ay, naku, kailangan talaga yan. Yung mga nanonood sa atin, marami akong pasyente breast cancer patients, ano? Nakakaawa nga eh, pag binigyan mo na ng diagnosis na gano'n. And the third
Prostate
one is
cancer.
prostate cancer for our male friends. And number 4
The
is
kidney transplant.
kidney transplant,
Yeah.
which is also available naman
Yes,
here
so
in
we are very
Cagayan.
happy.
Yes, so available na, they can do it, ha?
It's the
I know
newest
the good surgeon for kidney.
Yes.
Oh, he's a good friend of mine, si Jason, no?
Yes.
Dr. Jason. Hello there, Dr. Jason. So, puntahan naman natin ngayon na, what about those who are non-PhilHealth members? Ako, nagkasakit ako, non-PhilHealth member ako. Can I avail of help also from PhilHealth?
Yes, yes, Doc. Before, there's a program under the Department of Health, term as the point of service. Now, Department of Health has, in partnership with PhilHealth, we changed the name to Point of Care. So for the Point of Care program, it is also known as the hospital-sponsored member. So who are these people who are classified under the Point of Care program? So first is non-members who upon admission, so they will determine that they are not PhilHealth members. So upon assessment by the medical social worker, and after assessment, they are classified under the class 3C or D, meaning to say the poorest of the poor, so they are eligible to be enrolled in the Point of Care program. Also, other eligibility is if even though you are a previous member, but you are not covered to avail of the benefit because of lack of regular contributions, but upon assessment of the medical social worker, it has also been classified as under class 3C or D. So they can also
Pwede
avail
pa
of the
rin.
Point of Care program.
At saka heto, hindi limited na, kumbaga, kailangan talaga, kunyari, nasagasaan, no? And then, dinala sa isang private institution. Tapos wala namang pera ito. So, papasok siya sa point of care. Pwede yon.
As of the moment, Doc, is
Hindi rin.
the hospitals under the Point of Care program is, as of the moment, mandatory sa DOH retained hospital. So in Region 10, under the Northern Mindanao Medical Center and the Mars in Osami City. It is also a DOH written hospital. And the additional hospital for the point of care program is the J.R. Bora Memorial City Hospital.
The
As of
one here
moment.
in
Yes,
City
in the
Hospital.
RCC.
Pero remember, like in Marawi, we have ang May Pakpak Medical Center. It's a DOH retained
Yes,
hospital.
it
So
is
pwede rin
mandatory.
sila.
It's
So
yes,
mandatory
it is
talaga sa kanila
mandatory
yun.
for all DOH written hospital.
In other words, wala silang choice kung di talagang tanggapin itong mga pasyente
Yes,
ito at i-absorb nila kung ano man yung expenses ng
Yes,
pasyente.
Doc.
Yes.
For
Okay.
our other hospitals under the different local chief executives, they are currently applying with us because it is not given automatically. There is
So hindi rin. So kung
yes.
baga they have to apply.
Accreditation.
Yes, for
Ah,
accreditation,
for accreditation
under
din.
the point of care. And then, the hospital will just pay 2,400 for the enrollment of that particular patient without PhilHealth membership. Now, bawing-bawi yung hospital, Doc. That is why we encourage public hospitals to really venture into this, no? You just pay 2,400 and we pay on the average around 6,000 to 8,000
Bawat,
as benefit.
yung sa mga mga simpleng mga sakit, di ba?
Yes.
So kung baga in terms of economics, it's a win-win situation naman,
Yes.
di ba? Now let's go into etong mga like ikaw Marlon, you're in the insurance talaga. So ikaw yung tao na point person doon. Would you say na lahat ng mga major areas natin meron talagang office doon?
Yes, because under PhilHealth law also, we are mandated to have at least one office in a province. So which means that one province, one PhilHealth office. And in fact, here in Region 10 or mostly nationwide, we have one office in every major city. And it will also happen that in a particular province or city, we have more than one office. So ganyan yung ano natin, no, direction that we would really want to go into the grassroots. Say for example, here in Cagayan de Oro, this is just one city having 2 districts. We have 3 offices here. One is in Robinsons, another one inside Northern Mindanao Medical Center, the biggest hospital in Region 10, and we have one, of course, in Trinidad building. Also, like in Bukidnon, we have an office in Malaybalay, Valencia,
So kung
and in
baga,
Maramag.
strategically located na hindi naman mahirap puntahan.
Yes,
yun
yes,
yung
yes.
mahalaga eh. Kung baga, alam ninyo, mahalaga kasi sa atin yan yung ease of getting into the office eh. Kasi syempre, kung hirap na hirap yung tao pumunta, eh di syempre, mahirap din naman mag-communicate sila. So, balikan natin, paano yung in terms of, kung ako nagpa-member ako, at kunyari John, balikan kita muna, paano yun sila, yung mga hospitals, o kaya naman ang mga doctors, how do they get into being accredited by PhilHealth? Kasi syempre, hindi man kaya lahat. Or would you say na lahat na ng hospitals natin accredited with PhilHealth?
The corporation would like to emphasize that accreditation is a privilege. It is not a right. So, all healthcare providers and all healthcare institutions should apply first for to the corporation before they will be accepted as accredited provider. For example, for the hospital, we need certain requirements. First is, they should have an updated license to operate from the Department of Health. So if they do not have an updated license to operate, we need to say they do not have the right to operate as a hospital.
So in other words, dito papasok yung partnership ninyo with Department of Health.
Yes.
Kasi ibig sabihin, kailangan na sila accredited muna sila. Mauuna ba ang accreditation sa Department of Health bago sa inyo?
yes.
Mauna kayo?
Mauna sila.
Mauna sila.
We really require the license to operate from Department of Health. Then aside from the license to operate, we also require that the hospital should fill up the PDR, or otherwise known as the provider data record. This will contain all the general information of the hospitals. Also the performance commitment. This is very important. It should be duly signed because in the performance commitment, it will indicate all the obligations of the hospital to the members and to the corporation. As the title says, it is a commitment.
Commitment eh.
Yes.
Kailangan, I am committed to serve. Di ba?
Yes.
Parang ganun.
Yeah.
So, kung sasabihin natin, hindi naman pala mahirap magpa-accredit. Ganun ba yun? Kunyari ako, gusto ko magpa-accredit. Ako, may-ari ako ng isang ospital, gusto ko ipa-accredit. Ganun lang ba kadali yun? Yung, kung fill-upan ko yung form, i-submit ko yung mga ano.
We have a term as automatic accreditation. Meaning to say, if the hospital will have an updated license to operate from Department of Health, and they submitted also the PDR, the performance commitment, and the corresponding accreditation fee, they, upon payment and submission of the requirements to PhilHealth, they will be deemed accredited. But for the renewal period after, because
So, kumbaga, na-aprobahan na siya.
Yes.
So, kailangan naman siyang i-renew kasi hindi naman siya for life,
Yes,
di
it is
ba?
for
Oo,
yearly.
good- yearly,
The
di ba?
validity is from January 1 of the current year to December 31 of the current year. For next year,
Mag-re-apply sila ulit.
yes, basing on our monitoring reports, their application for renewal will undergo the sub-accreditation committee meeting.
So, doon yun papasok ngayon yung inyong bench booking ninyo.
Yes,
Which we
around-
will discuss pagbalik natin. We'll
Okay.
take a very short break. At pwede po kayo magpadala na inyong mga katanungan. Okay? Sige po.
Every hour of every day, any family member can watch. Hope Channel is educational, inspirational, focusing on lifestyle and health, and offering programs to young and old alike that teach health, culture, positive values, and spirituality. Welcome to Hope Channel.
To me, the joy, which money cannot buy.
Lee and very hospitable, and most of all,
Take part of your operation.
Dynamic Living returns with new episodes now on Mondays, 6 to 7 p.m. Dynamic Living, the Total You on Mondays.
Are you a member of PhilHealth, sir?
Yes, ma'am.
Have you tried its benefits?
Yes, I've been hospitalized, operated, and every time I get some illness, I go to the PhilHealth, recognized facilities, hospital, clinics.
Para sa ako, murag, wala pang maghihatag yung benepisyo nga ihatag na sa ako. Para sa ako, nakatabang nagyapon kay ako naman sa nagamit ang gyapon sa one time na sa akong bata, nagamit ko pero nagamit ko siya, gamay ra magyapon na nakuha gyapon sa
wala pa ko kaso like sa benepisyo sa kanang PhilHealth kay kaloy sa Dios purayabuyag man akong pamilya wala pa bisag usa nga na hospital pero sa akong mga igsuon na benefit na nila ang ilahang PhilHealth kay kanang mga anak ka kinahanglan naman ang PhilHealth nya kung check up ka kinahanglan pod ang PhilHealth.
As per experience, when a person got hospitalized, of course, the admin or HR manager just fill up the or give you the record of PhilHealth, and the PhilHealth representative in the hospital will do everything about that. That's very comfortable to the patient.
Ang PhilHealth, dako kay nagikatabang sa ako. So far, kapila na ko na operahan, dako kay siya gikatabang. And then kung ato ka sa ospital, pangutanong ka na PhilHealth, diretso ra kanila dawaton sa ospital.
Kinahanglanon maguni sa matag pamilya nga naayod tay kaugalingon nga PhilHealth kay dili nato matag-an ang disgrasya or mga aksidente nga mahitabo sa tong pamilya. So dako kayong tabang ang PhilHealth kay kung adto gugag hospital nga wala kay PhilHealth card, dili ka dawaton dabigwa kay kwarta. Diha ra kataman sa gawas.
The record of remittances of PhilHealth will arrive, for me, it arrived 2 years. Then sometimes there are reimbursement, overpayment by PhilHealth to the hospital, which the patients usually just ignore them. And it goes to the hospital. I do not know if the hospital gives them back to PhilHealth.
pero ang ako lang malibugan sa ila kanang dapat unta sa PhilHealth. Nayon ta kanang kasi di mato sa magamit ang PhilHealth, dapat unsa na say kanang benepisyo ba kanang murag insurance ba nga pag na mag-retire na tanatay makuha gyapon ng tana mo lang ako sa PhilHealth. Hindi man sa magamit gud nato.
Sometimes when they know that you are a PhilHealth member, they charge exorbitantly just to consume your PhilHealth. Because there is a category of PhilHealth, for example, room charges, professional fee, medicine. They consume, they maximize everything. So who gets the benefits? It's not much on the patient, but on the hospital probably.
Welcome back to Dynamic Living, the Total You with our episode with the PhilHealth, taking care of the Filipino people. So napanood po namin yung inyong mga mga sentiments. No? I'd like our panelists here to react to some of this. Who would want to dare?
First, it's very inspiring, Doctora, hearing those people. We do not know them, but it puts meaning to what we are actually doing. However, we understand that there are still gaps that we need to fill in. No? Say, for example, that security guard saying that will it be possible that after retirement he will still have PhilHealth benefits? And the answer of that is yes, positive yes. No? When you get the age of 60, you need not pay anything to PhilHealth so long as you have 10 years contribution, you and your beneficiaries can enjoy the benefit
so,
of
napakaganda pala
PhilHealth.
niyan, no? Ako hindi ko
Yes.
din alam yan, eh. So, you mean na ang ating pagbabayad na ating mga contributions is up to 60, the age of 60?
When you are no longer gainfully employed, because
okay.
there are people still gainfully employed or having businesses, meron
So,
pang kita.
so pwede pa silang mag-contribute?
Tuloy-tuloy pa yung pagbabayad. So, in effect, when you retire, then you stop paying PhilHealth, and then there is this 10 years requirement. If you qualify to that, then for your lifetime, for the rest of your life.
That's what we call the lifetime member program, no?
Of
Yeah, so
PhilHealth.
ang requirement lang is 10 years at least na
Yes.
pinaka-minimum na nakapag-contribute sila
Yes,
para maging
yes.
lifetime member sila.
Yes, and we also would like to look back if wala pa ka nag 10 years in PhilHealth, no? We can look back your contributions under the Medicare program, under GSIS and SSS before. So that you will really, in the hope that you will qualify into that 10 years.
So, ibig
That
sabihin,
is-
you are very friendly naman to this type
Yes.
of mga situations. Kumbaga, hindi naman hard and fast rule na hindi siya umabot. Kunyari, 8 years lang siya.
Yes.
Tapos, kailangan niya ngayon. So, pwede naman ninyong i-review.
Yes.
So, that's the beauty there.
We
Yes.
are very liberal in favor of our members. That is really the essence of social health insurance. No, those who are earning will subsidize those who are not.
Those who are well will subsidize those who are
Yes.
sick.
Those who are young will subsidize those who
The
are
old,
old.
yes.
We are really following that principle. Kaya hindi mabahala yung si Mr. Security Guard, no, that after retirement,
Nawala na,
yes,
hindi na siya
nawala
pwede.
na. And another reaction to that, yung isa pang in-interview natin, no, the one very elaborate in his discussion. Yes, there are times na hindi na ma-inform yung member that PhilHealth is paying the hospitals. But rest assured, we require hospitals to report to us those unclaimed balances, so that we will be able to check if indeed napunta ba talaga sa member eventually yung the benefits that we are paying. We are checking on this one. We are requiring the hospitals to submit all these reports to us, so that all will be well for our members, because eventually, or at the end of the day, the pera to ng mga members natin, we need to protect it.
Pero ang ikinaganda lang kasi nito, attorney, sa PhilHealth, it's a system that is very dynamic, just like dynamic living. And it's something na you are, always attuned to the changes in time. Kumbaga, hindi siya yung one time, big time na sinet up ninyo without really the intent of learning more, improving more, in order to serve more.
Yes, we develop, we innovate. So we also study what is needed by our members. That's why we slowly and we improve on our benefits. Also, as to the system, as to the processing, we also improve to better serve our members. Just like for membership, before we have required documents to attach with our PMRF, that is the form when you want to become a member. With the new law on PhilHealth, we only require just the PMRF and no more attachment for you to become
So,
a
ibig
member.
sabihin, fill upan lang nila yon, pagkatapos isasubmit, okay na yun.
As to the primary member.
Yung una.
Yeah.
Yes. Pero paano yun na attorney? Like, meron man tayong mga kaibigan dyan na hindi man marunong no read, no write naman sila. So, paano yun? Is there a desk in the PhilHealth office that will assist them para naman na matanong na lang sila at i-fill up na lang yon?
Yeah, we have this public assistance desk, which is manned by a regular employee, and it assists the actually all members is assisted. All members are assisted kung may tanong or kung may kailangan, like in that instance na hindi marunong sumulat. So there's always a person from PhilHealth that will assist
Pag
him.
pumunta ka sa PhilHealth, naku, sangkaterbang tao, ang dami-dami talaga. Pag ako pumupunta doon, kailangan mauuna ako sa pila. So wala pang 7:30, actually nandun na ako. Dahil pagdating ng alas 8 or alas 9 ka pumunta, hindi ka na makagalaw sa dami ng tao, no, na pumupunta doon. Which actually goes to show the trust of the people in the services that you are able to give them, di ba?
Yes. But we really acknowledge that kind of challenge, Doc, no? That is why we are venturing into online. Like we have the online membership application, online payment, online check on your eligibility so that hospitals will know at the point of sale, meaning doon pa sa hospital, they will know that this member is eligible or not for PhilHealth benefits. There is a portal that we would try to install in every hospital so that the hospital and the member will not anymore go to PhilHealth.
Ay, napakaganda niyan.
Yes,
Kasi
yes.
that means it will ease the burden
Yes.
on the part of the hospital, on the part of the member, on the part of PhilHealth also, kasi para ma-decongest kayo, di ba? So balikan ko kanina si Dr. John, kasi kanina before we took the break, we were discussing, madali lang naman pala maging member ang isang healthcare provider or institution at saka yung mismong espesyalista.
Yes, Doc. But before going to that question, I would like to add something was what Master Marlon said regarding for the lifetime member. For the doctors, several years ago, di ba, sabi ni Sir Marlon is, upon the age of 60, lifetime member. But for the doctors, as long as they are continue practicing after the age of 60 and continuing to receive reimbursement from PhilHealth, they are required to still enroll in PhilHealth. So that is why several years ago, we have many colleagues, younger colleagues, above 60, that they went back to our office to re-enroll as individual paying member.
So pwede yun. Na,
Because it is required for them. As long as for the doctors are still receiving reimbursement from PhilHealth, they are required.
So malapit na. So ibig sabihin ako kasi malapit-lapit na ako umabot sa 60 na yan. So kailangan ako mag-re-enroll. Ganun ba yun?
Actually, continue paying.
Continue
Yes, you
paying.
are still
Yes.
paying your contribution.
Yes.
You should still continue paying as long as you are...
So heto, we've been talking about hospitalizations. Before I leave the topic on hospitalizations and move further to outpatient services, kasi isa ito sa pinoprovide ninyo, lalo na may mga bago kayo dyan. Hetong ano tong no balance billing? Kasi minsan naririnig natin, no balance billing ito. Lahat ba ng institutions pwede nito? O pangalawa, lahat ba ng kaso pwede dito? At sino ang pwedeng mag-avail?
Okay. Sa no balance billing, this is for sponsored program members, no?
Pag
or
sinabi
indigent-
mong sponsored programs, kailangan i-clarify natin sa mga viewers natin that these are the people who are enrolled by
the local government units or any other private establishment who sees that a particular family would really need to have a social health insurance protection. These are the sponsored program members. If we say indigent members, these are members enrolled by the national government. Also
So,
poor
under-sponsored
families.
pa rin
Yes.
yan?
Dati kasi, when we say sponsored program, both LGU and national government sponsored, under na yan ang sponsored program. Now, we put a delineation. If we say indigent program, these are sponsored by the national government. And then when we say sponsored program, these are paid by the local government units or any private sector who would want
Paano
to
yun,
enroll
Marlon?
pauper families.
Yeah, sinabi mo na babayaran nung nag-sponsor, either the LGU, yung kunyari, the city government of Cagayan de Oro, o kaya naman ng province of Bukidnon, o kaya naman ang DOH, pagka yung sa national. Pag sinabi mong ganyan, is it a one-time, big time? In other words, isang beses lang silang magbabayad para sa akin. Kunyari, if I qualify as a sponsored member, they pay only how much, and then will it afford, it will make me be a member of PhilHealth, availing of all the benefits for my entire lifetime?
Okay.
Or every year, kailangan ding baguhin?
For the national government enrollees, it is actually provided by law. So there's no problem with that. One-time, big-time payment, one-time, big-time enrollment. But in cases of local government units enrolling to PhilHealth, year by year, they need to manifest their intention to enroll to PhilHealth. And with that intention to enroll is that we need a budget backup, an approved budget backup. And if we see that the requirements are complete, then the local government unit, the LCA, local chief executive, will sign a memorandum of agreement with us or a commitment with us that he will
So anong
enroll
mangyayari
in number of families.
kung sakali, walang problema ang sa national kasi sabi mo, provided, mandated by law. Pero yung mga LGUs na sponsored na yan, anong mangyayari? Kung sakaling si local executive, hindi niya na ni-renew yan the following year. So what happens to my membership? Kasi syempre, meron tayong mga viewers nagwo-wonder din na, what happens to me now? Supposing na natapos na hetong 2014, tapos sa 2015, hindi ako ni-renew ni Mayor. Anong mangyayari sa akin pag nagkasakit ako?
Okay.
Una. Pangalawa, kung sakali, can I have the option na ako na lang ang magtuloy noon? So, pangatlo naman, gaano karaming membro ng aking pamilya ang pwedeng kasali nito?
Okay. Sige. The options are, number one, the topic that we discussed a while ago, the point of care. Pag ikaw hindi ni-renew ni Mayor or ni Governor, for example, you can visit NMMC or JR Moore Hospital or Mars Training Hospital in Ozamis so that you will be enrolled under the point of care program. Second is that you can continue as individually paying member of PhilHealth. And with your membership to PhilHealth, kasali na dyan yung mga anak mo, 20 and below. Lahat.
20 and below?
Lahat sila. May it be legitimate, illegitimate, adopted with court orders, of course. And then, kasali na rin yung legitimate spouse. As a general rule.
Hindi kasama si illegitimate.
Yes, as a general rule, isa lang po yung legitimate spouse.
Baka naman legitimate, 5 naman.
For our Muslim brothers, then they are allowed under the law.
They're allowed under the law.
So,
So, paano yun? So, 20 and below. Children. Paano kung 10 o 20 yung kanyang anak nga? So, pwede pa rin yun.
Yes,
They
it won't matter actually. It won't matter actually, no? And then, on top of those two, meron pa din yung parents, 60 and above.
Parents, oo.
60 and above.
So, paano
yung
yun?
parents mo mismo, hindi
yung mga
in-laws.
magulang mo, hindi yung in-laws. So, paano? Kunyari, ikaw, si nanay at si tatay mo under sa'yo, yung kapatid mo, meron din siyang PhilHealth member din siya. Kailangan, pwede rin ba maklaim ni nanay at ni tatay yung sa kabila? Or iisa lang sa inyo ang pwedeng mag-carry noon?
Only one PhilHealth member will declare a particular dependent.
So, hindi po pwede tatlo sila?
In that case, like, in my case, dalawa kami nagtatrabaho. Magpipili lang kami who will declare my mom or my dad, no? Because actually our systems in PhilHealth can track those people we consider as dependents. This also is true for our children. If the couple will have 4 children, pwede tigda-dalawa sila, pwede 1 and then the other is 3, or pwede lahat doon sa
Now, so that is under the membership natin. So paano yung mga members natin? So ako member na, kunya nagpa-member ako. Magkano yung babayaran ng isang membro? Kasi syempre, we have also to discuss para ma-aware yung ating mga members na ito yung kanilang obligation every year or monthly kaya. Pangalawa, to encourage our viewers to be religious in paying their dues, di ba? Yun yung panawagan natin, di ba? Kasi magkaakibat nga tayo, yes.
Yes, for our members under the employed sector, they will pay 2.5% of their monthly gross salary. No, mauna that is their rate of payment. For our individually paying members, we pay 2,400 every year. However, we can pay that by quarter, and that is 600 per quarter. For our OFWs, they need to pay 2,400 for 1 year. The mode of payment really is at least 1 year.
So pag sinabi mo na yun yung bayaran, whether I'm a teacher or I'm a doctor or a business person, we would be paying the same for the entire year.
There is a provision if the combined income is more than 25,000 pesos a month, they are required to pay 300 per month. So as what Sir Marlon has said, instead
so
of...
that's 3,600.
Yes, that is why when the going back to the healthcare professionals who wish to engage with PhilHealth or accredited with PhilHealth, they should show a proof of premium contribution. If regarding, as what Sir Marlon has said, employed sector, around 2.5%. If for the IPM, we require them to pay 300 per month. So, 3,600 per year.
So, magaan lang naman pala Kahit na mag-alkansya ka, kayang-kaya yan.
For 2-4, that would be 660 a day.
Yes,
6 pesos
parang
and 60
lang.
cents.
So, parang naghulog ka lang sa lugian mo. Now, etong ating outpatient services, paano ito? What are these benefits na they can avail of? Kasi nung araw, parang kailangan ma-admit ka ngayon, paano yung mga outpatient services? Pwede ba ordinary check-up? O kaya executive check-up? Sige nga.
As of the moment, regarding the outpatient services, as a total as check-up, which is meaning to say, tamang serbisyong kalusugang pangpamilya, the only accredited outpatient facilities are the rural health units or the city health offices. So, regarding your question of executive check-up, outpatient services, it is not allowed.
Pero meron tayong mga bago ngayon na pwede sa rural health units
Yes,
or
yes.
city health offices.
Yes, oh.
And these are, what are these services na they can avail of?
For example, Doc, regarding the acute gastroenteritis with mild or no dehydration, also the pneumonia low risk, so they can also avail. For example, they can avail in the rural health units.
Libre
Accredited.
yun?
Yes, yes.
Wala silang babayaran doon?
Yes, walang babayaran.
So, ibig sabihin, yung kanilang x-ray doon, yung kanilang
Yes.
laboratory
Yeah, it includes
exams, libre yun.
consultation,
Even the
diagnostic
consultation.
Yes.
examinations, and
Pati ba
even
ang
the
gamot?
drugs and medicines.
wow, ang galing
For now,
naman.
that's for asthma, for UTI, for pneumonia, and for acute gastroenteritis.
Yes, so napakaganda, no? Ang dami ng services na pwede nilang i-avail.
But
Then, yes, but there's additional now, Doc, that is termed as the PCB1. That for the PCB2, we have new services for the hypertension and for the diabetes mellitus.
So kasali na din.
Yes.
Oh, napakaganda
We are
talaga.
expanding our outpatient services.
So kailangan magbayad tayo
That
para
is why-
maka-avail tayo.
Yes, that is why later on, we really plan to roll it out also to the private clinics because as of the moment, we can see that there are many enrolled members to a specific RHU which it is termed as congested. So we plan really to roll it out
Totoo
to the
yan.
private
Kasi kung
sectors.
sa RHUs lang natin yan gagawin, ang mangyayari, magiging congested sila doon. Meron naman tayong mga kaakibat na mga private practitioners na their clinics would be open to this type of cases. Ano? So sagutin natin tong kanyang katanungan muna. Good evening, tanong ko lang po, member po ako sa PhilHealth, but the problem is I stopped paying for more than 4 years. Single po ako, ano po ang pwede kong gawin? Yes, who would like to answer that?
You just pay again to PhilHealth using your number that was issued to you 4 years back or many years back.
Matitrace ba yan?
Yes,
Niya
we
yung
have
number na yan?
records and we have posted your payments. So just give us your PhilHealth number and we will check kung kailan ka last nagbayad, and then you pay now so that you will reactivate your membership, and then
Magkano yung babayaran niya pag nagpa-reactivate siya?
that will be 600 if 600 per quarter if under the individually paying members or yung ating mga self-employed.
Okay, meron naman ditong katanungan, na-misspell po ang middle name ko. So when they verified it kasi, need ng parent ko para magamit. How can I correct the misspelling in the fastest possible way?
Okay, you just need to fill up the PMRF form and then you bring your birth certificate showing to us the correct middle name, or in the absence of that birth certificate, any other document that will show the true and correct spelling of your...
So hindi naman mahirap pala.
Yes.
So you make it really sound very easy. In other words, talagang very pro-member kayo.
Yes.
So yun yung mahalaga nun. So balikan ko, tanungin ko naman kayo ngayon, how do you monitor naman? No? Siyempre, there are challenges for everything that we do. So there's always a challenge and there are always corrective measures also and a check and balance. So how do you do monitoring and making sure na heto inyong mga partners, ang mga partners natin, ang ating mga specialista, ang ating mga healthcare institutions, that they are actually giving the best, correct, quality services to the patient members?
Before, Doc, we are using the benchbook monitoring system. But now, we are using a new system for approval. It is termed as the HCP Pass, meaning to say, Healthcare Providers Performance Assessment System. This is our new monitoring tool. Then, from the monitoring tool, we will look at the performance commitment duly signed by the medical director or owner of the hospital during the application of the hospital to PhilHealth. So, it is indicated in the performance commitment their obligations. So, if there is one provision that they will not comply,
kung na-violate nila,
yes,
kunyari,
it is a ground for suspension or revocation with due process.
So meron din kayong mga nasususpend, meron din kayong mga licenses na na-revoke.
Their accreditation with PhilHealth are revoked.
Yes.
The same thing with the professionals. We are also requiring the professionals now to also sign the performance commitment, duly signed, so that it will also indicate their obligations to the corporation and to the members. So if they will violate the performance commitment, it
alam
is
nila
also
na
a
pwede
ground.
silang isuspend.
Yes, it is a ground for suspension or revocation which will also undergo due process.
Okay.
In the case of NBB policy, in relation to that, for those people who are not complying, we already consider it as a fraud. So there will be corresponding penalties and
But they
sanctions
can
for that.
reapply after. Kunyari, na-suspend ninyo o kaya na-revoke ninyo yon ang kanilang accreditation, can they reapply again? And sign again another commitment?
Regarding the revocation, as stated in the IRR, if the hospital or the professional is whose accreditation has been revoked, they cannot apply for accreditation. But for suspension, they have the option to reapply after the suspension has been served. And also, if there is a corresponding fine, if it has been paid already, they can reapply, but it is not a guarantee that
they will be accepted and given.
Because all application will undergo deliberation.
Okay. Napakabilis po ng oras ko dito sa Dynamic Living the Total You. Tapos na naman po ako. At napakasaya po na aming discussion. I'm very sure our viewers there learned a lot just as I did. I'd like to thank my guests and I'd like them to say something to inspire our members out there listening, watching us. I'd like to thank you, Marlon. Yes?
Yes, Doc, thank you very much for inviting us here. And we would like to encourage all our members to continue paying to PhilHealth. You religiously pay your premium so that you'll be able to use your PhilHealth benefits at any time, and not only you, including your dependents, the members of your families. And another reminder is that if you would want to pay your contributions to PhilHealth, do it prior to the deadline so that you will not be lining up with the long queues in the office.
Hindi Alam mo naman tayong Pinoy, last minute. Yes, attorney, what would you like to say to our viewers?
Thank you so much, Doc. And in addition to what Marlon had said, if you regularly pay your premiums, continuous din yung availment niyo of benefits. And for inquiries, for more information about PhilHealth, please visit our website, www.philhealth.gov.ph, and you can call us at 728957.
Okay, Dr. Jonathan?
Thank you, Doc, for the invitation. And for our members there who have queries regarding hospitalization, so they can just visit the various local health insurance offices or the regional offices. And also for the doctors who wish to be accredited, because there are still many doctors who are still not accredited with PhilHealth, so they can also visit the various local health insurance offices and also our office in the PhilHealth Regional Office for their queries.
Yes. Alam niyo po mga kaibigan, nabasa ko doon sa ng PhilHealth. Sabi dito tapat na serbisyo, sapat na benepisyo, lahat tayo panalo, no? So, I would like to say in parting with this episode of ours that in 3 John 1:2 it says, "Beloved, I pray that all may go well with you and that you may be in good health." In other words, we need as partners, because we need our partnership with PhilHealth, we need to prepare also and to be regular in our contributions, knowing that PhilHealth also will need our commitment to be with them in providing our health needs. Magandang gabi po sa inyong lahat.